Hey guys, Dr. Daniel here, and I want to talk a little bit about what a normal spine is compared to an abnormal spine. We still get a lot of questions from you all after going over your x-rays, and so I thought I'd just create a quick video to help you understand that. When you look at the spine, and especially when you look at your x-rays, really there are two different positions that you should be paying attention to. From the front, in other words, when you're standing this way and the x-ray comes in from the front, that's one position. And then position number two is whenever we take x-rays from the side. Now, what you should see is when you look at it from the front, simply put, it should just be straight up and down. In other words, you know this is not normal. When the spine starts to shift off into one direction, this creates a lot of imbalance in terms of what's happening to the muscles between left and right. And of course, a spine that's tilted this way, those muscular imbalances as time goes on makes you more susceptible to sprain strain type of injuries. It also creates a lot of what's called shearing forces, meaning there are abnormal weights being placed onto these joints, which is going to accelerate the deterioration process. So literally this spine here would be aging faster than somebody who had a normal neutral spine. Now, the second position, which is actually the most important position, and in fact most people don't realize this, but when you look at the spine from the side, it should be curved. It's not designed to be straight up and down. So when you look at somebody's posture, this is a good indicator as to whether or not they actually have a healthy spine. When you see people whose shoulders are rolled forward or where their head is tilted forward, or sometimes you can see where the bottom part of their body is actually tilting in or tilting out, these are signs and hallmark symptoms of an abnormal spine or an unhealthy spine. Again, when you look at the spine from the side, you're supposed to see three main curves, one in the neck, one in the mid-back, and then one in the low back. Now, there are established norms in terms of how much curvature, just like we know that there's established norms for blood pressure or pulse rate or cholesterol levels. The same is true with your spine. And when you take an x-ray, that's why that x-ray is so important, because we're able to determine how much stress is being applied to these joints, and then how much is that going to contribute to deterioration or degeneration later in life? And more importantly, can we prevent it, right? Is this something that we can correct? Now, when you look at the spine from the side, in the neck, you want to see that it's curved. When we carry our head forward, this is basically what's happening is you're losing that curve. There is more compression that can actually take place, which then starts to break down these joints. It starts to irritate those nerves, and you start to get things like headaches and neck pain and back pain and such. Same thing in the low back. When we sit down, what happens is the pelvis starts to tilt forward, so we lose that curve and there is more compression that takes place. So again, simply put, from the front, you want to see that things are straight up and down. From the side, you want to see that there are curves.